How you guys doing? How you guys doing? This is your boy the MC, and we are here once again. Now, before I get into the topic that I want to talk about today, I want to thank all our supporters, all our subscribers that have been supporting us. Kindly, I pray and ask you to keep supporting us. And right now, we are running a challenge to hit 500 subscribers, and I beg all of you, just go to our YouTube channel pale Spark Plug TV and subscribe to fikisha 500. That is the challenge that we are having right now. Hashtag road to 500 subscribers. Now, we are here to talk about insurance, and to be specific, we are here to talk about health insurance. Yeah, you heard me right. Health insurance. Now, we've discussed some episodes about this particular topic, and when we started on our episode 1, we talked about what you need to do in order to get an insurance cover. We talked about the coverage in terms of hospital, how many hospital will you get, what are the benefits that you're going to get with this particular health insurance. Now, we went ahead and also talked about in our episode 2, we talked about the factors that you need to consider after deciding on the company that you're going to buy an insurance cover with. The first episode, we talked about finding the company. Now, the second episode, we talked about factors now you need to do to ensure that you get a favorable medical cover within the company that you've chosen. Now, we talked about, are this company able to give you discount? What are the benefits? What are the premium that you're going to get? And on this premium, how much benefit are you getting? Or what are the limits that you're going to enjoy? And then we went on to episode 3. Now, episode 3, we talked about mistakes that we make when we go to buy health cover. We make a lot of mistakes. Some of them we know, these mistakes that we make. Some the mistakes we make we don't know. For example, you buy a medical cover, you have a problem, but you don't disclose the problem that you have. And I said on that episode that this problem will come and catch up with you when you're now at the hospital. Now, today we're going to talk about yet another episode. Now, on our episode 4, we want to talk about one crucial thing in health insurance. Now, we're going to talk about waiting period. Waiting period. This is one thing that as a buyer or as someone who is looking for a health cover, you need to check keenly. Waiting period. First of all, let's define waiting period. What is a waiting period? I know most of you know what a waiting period is, but for the sake of the people who probably don't have an idea what it is, a waiting period is the period that you take after buying buying your insurance cover. There's a period that you have to take in order for you to start enjoying the benefits. Now, in this period, there are a lot of things that we tend to look at. Now, the reason why insurance companies have waiting period is because, you see, someone might just come and buy an insurance cover, and this person had a problem. For example, he had a pre-existing condition, and this person comes to an insurance company to buy a health cover for that specific reason. I'm not saying it's bad to buy a health cover for that specific reason, but this person comes and buys a health cover for that specific reason. He buys a cover today, he pays, and then tomorrow or maybe 2 days after, this person is in the hospital. Now, that is why waiting periods are there, so that at least insurance companies are able to look at the clients that they are going to onboard. What type of clients are they going to have? Are they clients that are coming in because they have a specific condition that they are fearing that maybe this condition might drain them financially, and this condition might the cost of treatment for this condition is way high. I'll talk about the types of like the diabetes, the cancers. We know very well that treating these particular conditions are way expensive. Now, there are different types of waiting period. Let's get this right. There are different types of waiting period. Now, the first type of waiting period is what we call a general waiting period. Yeah, general waiting period. Now, general waiting period normally takes between 14 days to 30 working days. Now, this is this waiting period will apply to most, or actually, let me say all the insurance that you go and buy, or all the companies that you tend to buy an insurance cover, medical insurance with. They have this general waiting period that may go maybe from day 1 to 14 days, or maybe from day 1 to 30 days. Now, at this particular point, you are not able to access any benefit within any facility. Get me right. At this particular point, when we have this general waiting period that takes between 14 days to 30 days, as a client, you can't, let me use that word, you cannot access any services in any hospital, be it malaria, or you're just going to have, Panadol, your 10 bob, or you want to just, do some checkup. Within this period, you can't access those benefits. That is why it's called a general waiting period. So it's a waiting period that, cut across all the benefits that you're going to be enjoying with this medical cover. Now, another waiting period that we have is now a waiting period that is based on the pre-existing conditions that you have. We talk about diabetes, we talk about cancer, we talk about blood pressure, we talk about a lot of these conditions that we have to just manage and all that. There is a waiting period for that, and quite a number of companies will give you this period between 6 months to 1 year. Understand me right? For you to enjoy benefits, for example, you bought a cover, maybe you had a high blood pressure, or you had diabetes and you need to use your health cover for this particular condition, then it means you'll need to wait for at least 6 months to 1 year for you to enjoy this particular medical cover. Now, I've had a lot of cases with clients where they come, hey Charles, what up? I need to buy a medical cover, and I'm buying a medical cover because I'm currently having some treatment for cancer, and therefore this treatment drains me down in terms of finances. I use a lot of money to treat myself, the medicines, the checkups, and the back and forth in the hospital. Now, I'm always frank, and I tell my clients that I'm going to give you this medical cover, but I have to tell you the truth. This cover is not going to help you at this particular point that you need it. There's a period that you'll have to wait in order for you to enjoy benefits on cancer. There are periods that you're going to wait in order for you to enjoy benefits on diabetes. So some of the clients, they'll walk away, they'll be like, oh, why should I wait? And I'm paying money and for this particular thing, why should I wait? Some of them will walk away. Well, some of them will just be like, okay, understood, let me onboard me on. So there is also that waiting period. Now, another waiting period that is there in health is waiting periods on maternity. Understand me right, our ladies in the house. Waiting period on maternity. Now, I've also had quite a number of cases. I've had quite a number of cases with our ladies. They'll be like, hey Charles, what's up? I need a medical cover. I'm about to do delivery in the next 9 months or in the next 7 months, and therefore I've walked across hospitals, and this is what they charge. So I'm here to buy a medical cover for delivery. Well, I'll give you the cover, but understand that a number of insurance companies don't just offer medical covers for delivery. You'll come, for example, you go to company A, they'll tell you, well, they can give you that maternity cover, but you'll have to buy inpatient, you'll have to buy outpatient, or you'll have to buy inpatient, and then you'll be able to buy that maternity. In most cases, inpatient is always mandatory because insurance put these things this way. The risk in inpatient is a bit, I would say a bit, low, because some people, for example, I don't know the last time I slept in an hospital because I was sick. I can't really remember, to be sincere. So the risk in inpatient is a bit low, but when they happen, the consequences or the effect to this, being on the hospital bed for a week is very high. It's like a plane accident. The chances of a plane getting into an accident is very low, but when they happen, I'm telling you, there is like zero survivors. When a plane crash happen, it's like zero survivors. So that's why most of the insurance company will have inpatient cover as a mandatory cover. Now, you walk into an insurance company, you've chosen the company, and then you go there and tell them, look, I'm here to buy a cover because I'm pregnant. Well, they'll give you a cover, but on top of that, you'll have to buy an inpatient cover in order for you to enjoy. But I do understand there are also some few, let me use that word few, companies that also will just give that package of maternity only. But in order for you to enjoy that particular maternity, there is a waiting period. And a waiting period on this maternity also goes between, it's always around between 9 months to 1 year for you to enjoy this particular cover. So in most cases I've had clients, I tell them, piga mahesabu, angalia utakuwa mjamzito lini, alafu take an insurance maybe 3 months before, or take an insurance maybe 6 or 5 months before, so that when the time of the delivery comes, inapata already that waiting period has lapsed, and now you can be able to enjoy your maternity limit. Now that is what we have on the waiting period case, and I'll request you, in case of any question, just go down to our comment section, drop your questions there, drop your comments there, and let us have an interaction about a health cover. At the end of the day, let us have an interaction that both of us will be able to enjoy and that both of us will be able to benefit from. Ask your questions there, drop your comment, and let's have an interactive session about waiting periods. That's all I had today. My name is Charles. Have a good day. Thank you.